only way of discovering the limits of the possible is to venture a little away past them to the impossible. Arthur C. Clarke. Welcome to the Guyana Dialogue. I'm your host, Shamiza Ali. Our topic tonight is Guyana's health sector, modernization, and challenges. The Guyana Dialogue is being sponsored by a Coordinating Council of Guyanese based in the US, UK, Canada, the Caribbean, and Guyana. Funding support is by well-known philanthropist Dave Narayan from Dave West Indian Imports. Please welcome my moderator for tonight, Dr. Tara Singh. Our panelists tonight are Professor Narayan Prasad, Professor Muniram Budu, Dr. Keshwar Ramkisoon. And our guest tonight is the Senior Presidential Advisor on Science and Healthcare Modernization in Guyana, Dr. Mahendra Carpen. Welcome, everyone.
Thank you. Thank you.
Dr. Tara, please go ahead.
Thank you very much, and welcome to our viewers. This evening, we are privileged to have one of the distinguished medical personnel in Guyana. Dr. Mahendra Carpen is an interventionist, cardiologist, and electrophysiologist as well. He's a senior advisor to the President of Guyana. I believe he holds many other hats, and he can correct me if I'm wrong. I think he also serves as a consultant to the Caribbean Heart Institute, and yeah, he just nodded his head, so that is correct. So we are very, he is often described as the most noted cardiologist in Guyana. So we are very pleased to have him to take time off his busy schedule. But before we start, Dr. Carpen, we know that the health sector gets its second biggest budget allocation for the past couple of years. That is because the government are putting great emphasis on healthcare. So if you can give us a short overview of the status of healthcare sector in Guyana, if you can juxtapose that with the private sector as well.
Well, thank you very much for having me on the program tonight. It's actually quite a pleasure to connect with you guys. Some of you I'm meeting for the first time, and some of you third. And I'm honored to be here. And yes, it is indeed true that the health sector in Guyana has received a significant budgetary allocation from the People's Progressive Party government. And that is a big jump from where we were in 2019. We got about 35 billion Guyana dollars. And the most recent 2025 budget, the Ministry of Health got 145 plus billion dollars. And this underscores a philosophy that the health of a nation is really the true wealth of our nation. And what's the point in having all of these resources and everything else if you have an unhealthy population? So in the last couple of years, what we have seen is a complete transformation of the health sector with health delivery to the population of Guyana. And this has been divided in several areas, but mainly there's a boom in the infrastructure development of the country, and health sector is one of those areas that are leading. So we've had the construction and establishment and operationalization of several brand new hospitals located strategically along the areas where we have our population centers. And so we have now within not too far distances, and if you measure distance in time, an hour of most of the major population centers, we have a new hospital fully equipped and operational that has been so within the last year. And we have seen, of course, challenges with establishing new things. They take a period of getting accustomed to the routines, establishing protocol, etc. But the population is benefiting notwithstanding the teething problem with these facilities, the population is benefiting. Now, we want to juxtapose the development in the last 3 years in Guyana to what happens not just, or what has happened not just historically in Guyana, but around the world. The pace of development of health sector of healthcare in Guyana is very rapid when compared to the normal pace of doing things. And I want to draw your attention to the philosophy of the president, where he is establishing a modus of leapfrogging the society in every aspect of development. There is usually a stepwise approach to development that, follows a certain charter in terms of time and development, reassessment, feasibilities, etc. But we are starting out from several years and decades behind the rest of the world. So in order to catch up, we have to move very fast, very rapidly. And we are indeed blessed with the resources to be able to do so. Of course, we have a few mistakes along the way. Things will not be perfect, but it also gives us time to establish and analyze where the shortcomings are. And we have the opportunity to fix them. So for healthcare, I'm actually quite excited where we are now and where we are going. And I'm fully appreciative of the support that we're getting from the decision makers to move healthcare along in Guyana for the population.
Is the private sector keeping abreast with the development in the public sector, or are they in advanced stage?
So when we started out this journey, the private sector was always ahead of the public sector. But what we have seen in the last 2 to 3 years, there is an equalization of the services and the infrastructure between public and private. So it would be a fair thing to say that those who can afford to pay versus those who cannot afford to pay in the private sector, they are getting an equivalent standard of care. And I can speak with authority, for example, on cardiac care. And Dr. Ramkisoon will appreciate this. When a patient has a heart attack, you go to the hospital. One of the things you need to get done as soon as possible is to do something called an angiogram to see where the blockage is that caused the heart attack and then fix it. In the Georgetown Public Hospital, this happens seamlessly from emergency room to cath lab. Patient have their procedures done and stented, central bypass surgery, whatever the case may be. And it's all done free of charge to the patient. That is in contrast to what happens in the private sector, where there is also that a bit services, those services available, but it's also accompanied by a cost factor to the patient. It's completely free in the public sector, but there's a cost in the private sector. And we are very pleased in Guyana to say that we are among the very, very few in the Caribbean that can actually do this for our population at large without costing the patient anything at the time of their problems.
Okay, thank you, Professor Boudou.
Yeah, Dr. Carpen, good to see you. You mentioned you're happy where you are with healthcare at the moment, and you're happy also where you're going. So, what are the goals for Guyana's healthcare modernization strategy? Is there a timeline for this, and how are you going to measure progress in what the president and you also indicated called healthcare transformation?
Yeah, great question, Professor. So we are happy mainly with the direction in which we are going and the pace at which we are getting there. There are always gaps and always room for improvement. And what we would want to measure our success by are two things really: patient satisfaction and outcome. Patient satisfaction is the immediate gratification. You come to the hospital in an emergency, the wait time is less, the access to the best healthcare, the appropriate interventions are there, and you'll get the treatment on time and to the best of the ability of the providers. And so that's the the immediate thing. But in the long term, what we want to look at is the survival and life expectancy. What are we achieving in terms of moving that needle? Right now, the life expectancy is about 70. There are places where life expectancy is beyond 80 and approaching 90. So we would like to get there. And if you look at our graphs, those are the things, it's moving in the right direction, but we would want to get there. And the programs that we're putting in place to get there would be the robust screening at the primary healthcare level, preventive medicine, and appropriate interventions. So we are happy mainly with the direction in which we are going and the speed at which we are approaching that destination.
Yeah. Because, when we hear from the various people in the healthcare industry, they're saying, look, we are building all these hospitals, but they are much more beyond the hospitals and perhaps equipping it. You have the patient care and outcomes, medical outcome. And so is that a focus also, these two latter, the patient outcome and patient care?
Yeah, so quality now becomes, a much more of a focal point for us. So it's not just about having a brand new hospital and, being able to say, yes, this exists, but how does it make people feel when they walk in there? How does it make the patient feel in their time of need? And that's when they're the most vulnerable. And that is definitely one of the things that we are addressing and starting to look at the patient not just as somebody who's sick, but as a customer that requires customer care and taking care of that person, not just that person, but their family as well.
Mhm.
So despite all of the challenges in human resources, etc., we are looking at ways in which we could have advocates in the hospital that take care of people. It's not an unusual thing for someone to be waiting in the emergency waiting room for an hour without getting attention. And for various reasons, there might be a motor vehicle accident or people who require much more acute care than the ones who are waiting there at the end of their work shift for a sore throat, for example. But it still does not mean that you shouldn't pay attention to them. But usually, in places where it's more developed, we'd have somebody going and talking to them to reassure them that, you still matter, what you're suffering from is still real, and we'll get to you, but just let us take care of these who can die before you.
Mhm.
So the quality of care and customer satisfaction is now the next level of thing that we are looking at to ensure that our service is better and meeting the appropriate standards.
Now, in terms of leapfrogging, what are the plans, if any, that Guyana has to be a leader in, say, leveraging AI, robotics, and similar technologies for successful healthcare outcome? Not simply to have all of these things, but to have successful healthcare outcome.
Yeah, a lot of that actually depends on vision. And I'm very, very happy that we have the leadership now at the central government and Ministry of Health with that kind of vision. They're looking at developing the health sector in four main aspects: to look at the infrastructure, which we're well on our way; two, the human resource capacity; the three, the technology incorporation; and four, how to do research that is driven towards better outcome. So infrastructure, human resource, technology, and research, data-driven management of the system. And we have indeed been embarking on plans to train more nurses, more technicians, and we have developed robust partnerships with established institutions for training and advanced training of our human resource. You talk about robotics, for example. We are actively in discussions with centers right in New York, the Northwell system, and Mount Sinai to see how we develop those to benefit our patients in Guyana. And we're looking forward actually to the day, and these are in the pipeline, where complex things can be done by surgeons residing not necessarily in Guyana, but they might be in New York, they might be somewhere else, but the patient is in Guyana. And robotics, combination with remote managed stuff and local human resource, can get that patient treated properly in more of a team-based effort. So we are integrating the latest in modern technology, the latest in artificial intelligence, to be able not just to treat patients but to manage the system.
Mhm. Well, I think I'll pass you to Dr. Ramkisoon, and I'll come back later.
Okay. Okay, Dr. Ramkisoon, over to you.
Good evening, everyone.
Uh,
Dr. Carpen, it's a pleasure to be on the program with you. And first, I would like to congratulate you on your new role as an advisor to the president. And I think it's very much appropriate that he had chosen you to do this job. And, we all look up to you because you're the cardiologist on the ground. And you're not only known in the Caribbean, but you're known outside of the Caribbean, also in New York and other states. From time to time, we do have patients that we do talk about. One of my questions for you this evening is, I know the president is working on an agenda for digitalization and rolling out of an electronic medical record system. I just wanted to know in what phase or how many phases this will be happening, and if it would include pharmacies, labs, radiology centers, and if it will include a buying option for the private sector so that everyone's healthcare is in one place. And when you finish putting in the stent in Georgetown Hospital, the guy in Crowwood Creek will see exactly what was done.
Yeah, thanks, Kesh, and I appreciate the kind words. You are absolutely correct that we have embarked on this digitalization and electronic medical record. Right now, pilot is the biggest center in the country, which is the Georgetown Public Hospital. And we've already started using aspects of the electronic medical record. As you would know, there are several components to this that are simple as scheduling appointments, but also much more complex things like prescriptions and management of inventory, pharmacy, etc. So we have that system now being rolled out in phase 3, you might want to say, at Georgetown Hospital. We also have it at the major health center in the country, the Festival City. And so once we have ironed out certain kinks there, then we plan on rolling out this uniform electronic medical record across the country to incorporate not just the public facilities, but also the private facilities as well, and private practitioners. And this will integrate quite well with our new digital ID that is to come on stream, that patients could have their medical information and have control over it as well for data protection and all the other patient rights and patient advocates, that we can have these bits of information available to them, and that they can share it with the authorized providers, practitioners, facilities, etc. The next phase is if we have stuff that is available in the possession of patients, that if they were to travel from Guyana and they come to New York and they see you, that same ID or the chip card will have their information, that they can plug it into your system. And you can say, hey, Mr. Jones had 3 stents. They were in these positions. These are the types of stents. These are the medications they were using. This is what they're allergic to, so don't try this. And, so that's where we're headed. So I'm actually quite excited by the question, and I'm grateful for the opportunity to actually talk about something like that I'm actually, I'm interested in being a little bit of a nerd myself.
Very well.
Dr. Tara?
Yeah. Since we started, we can wait another 5 minutes before the break.
Yes, certainly. Yes.
Yeah. Dr. Keshwar, continue.
Great. Thank you very much. Doc, when this new healthcare system is rolled out, I will assume that all the different players in healthcare providers, not only the cardiologists, but the primary care, OBGYN, they will all be using the same platform. And this will make things easier for physical therapists and pharmacists and everyone to be on the same page when caring for patient. If you had to put a timeline on it, I know we're now starting, but you see a bridge was built in a very short period of time that we're driving over in less than 2 minutes. So if you tell me this healthcare system is going to be there by the next election, I will believe you as well. Do we have a timeline?
Yeah, ordinarily things like this will take between 5 to 10 years to roll out. But the person in charge of all of this, President Ali, doesn't work along normal timelines. So it would not surprise me if all of this is functional within the next 3 years.
It's very good. I think this is going to be great for the country. It'll be great for patient care, and it will allow us to do more research on West Indian population, particularly in Guyana.
Absolutely.
When you look back at the coronary vascular disease rate in the Caribbean, you and I both know it's much higher than every other part of the Caribbean and the rest of the world. So by having good electronic medical data, we're able to track patients' HbA1c, their LDLs, their blood pressure. We're able to make changes and end coronary vascular disease. We're able to get in contact with patients because you'll know their addresses at home to make phone calls and more Zoom connections. And it's just going to be one great big healthcare system. I'm excited.
Yes, that's exactly correct. What we're looking for now, one of the main focus that we have is to tackle the chronic non-communicable diseases. And just from my little experience in Guyana here, about 30% or 1/3 of my patients who come into the hospital with heart attacks are now finding out for the very first time that they're diabetic. So that's a big problem, and it's a population-wide issue. And so we're trying now our best to try and get our data together to try and tackle decisively these conditions: diabetes, hypertension, kidney disease, stroke, etc., bad cholesterol. And what is good now that Guyana is on the world map, so to say, a lot of interventions that were previously taking several years to get to our shores are now rapidly coming in. All the new medications that are available in the US, etc., can be found in Guyana as well through authorized distributorship, not just through suitcase mode of transportation.
Very good. I'm assuming that we're going to have some coronary CTs and maybe nuclear stress tests as well.
So that's one of the fantastic things about where we're heading to in this country. I think we're changing the definition of what primary healthcare is. And we are going to include within that umbrella of primary healthcare things like coronary CTs and screening for coronary artery disease. Let's face it, that's our number one cause of death. And if we do not put the resources where it needs to be, we'll continue to suffer from that as the number one cause of death. So yeah, we are changing definitions in this country. A CT scan will now be included under primary health care. So if you have clinical indications for screening, for disease processes, etc., these are included in all of the hospitals that we have built within the last couple of years for patients to actually have access to them. Of course, they're going to have hiccups now and then, but that's the focus and that's the drive, that's the direction in which we're headed.
I think that's a very, very good intervention, because I'll tell you, I spend time fighting with insurance companies here to get my patient's coronary CT. When I think, the recipe for disaster is there. And sometimes it takes hours getting on the phone to speak with someone, doing a peer-to-peer. So if this is Guyana and we have a coronary CT as part of primary health prevention, I think we're at the top of the bell curve already.
That's the leapfrogging we're talking about.
That's right. That's right.
All right. We must take a break now, Shamiza.
Yes, we will take a break. We'll be right back after these messages.
Thank you.
Yeah,
And we are
okay, we are
back.
back. Yeah, yeah, Dr. Carpen, you said that there are four aspects or four components of the healthcare system, one being human resource. Now, when you speak about human resource, are you talking about, I guess you're talking about training. Also, will that include the attitude of staff towards patients? Because there has been a lot of complaints about nurses in particular being very not too kind or civil to patients. I don't know if you have, I'm sure you might have come across cases like that, and what the administration is doing to mitigate that problem, if not to solve it.
Yeah. Well, thanks for raising that, and I'm glad you did, because there are isolated cases, thankfully, only isolated cases of, attitudes at the first interaction or second interaction with healthcare professionals that have made patients uncomfortable, made families uncomfortable and disgruntled. And once that is brought to the attention, usually of the individual hospital or health facility, that person is dealt with. Traditionally, we have embarked more on punitive measures and disciplinary measures, but I think, we have to embrace and broaden our interventions, not just to be punitive or correctional, but also training, customer care. That's why I had mentioned earlier when we talked that we're looking at the patient now as a customer, that we're supposed to be able to satisfy their needs. And even if you can't satisfy their needs completely, you have to make that person feel as though they are valuable, their complaints are real, and there's validity in which to what they are seeking. So yes, they have been isolated. Thankfully, not a, a pervasive type of attitude in the entire system. And we are taking steps. We have taken steps for correction, and perhaps as we move along, as people have less and less things to be disgruntled about. You know, this example came as we were talking about in the break before about the bridge. Imagine waking up at 4 and 5 in the morning and having to face traffic to come to work and then sit down there, and your mood is not generally at the best. Now perhaps we can have a change in attitude. People can be a little bit happier, a little less disgruntled by having to face all the challenges before they actually start a day's work. And as the society improves in, several areas, that improves the happiness index and the quality of life among people, we're hoping and we're envisioning a change in attitude and customer service, not just in healthcare, but across the country in every sector.
Is the attrition rate of nurses still a problem? What measures you're taking to mitigate or resolve that?
Yeah. So small countries like ours, and nursing in particular, we have faced a worldwide shortage of skilled staff. And we are particularly vulnerable to recruitment drives from the more developed countries like Canada, the UK, sometimes the US. They come down with their recruiters and offer packages which we are unable to compete with a lot of the times. And that's the reality. That's not just us, that's across the world. But as we progress and we make more available to our human resources, not just nurses, but teachers, policemen, soldiers, etc., we are finding and we're looking at these numbers to decrease, so that if one of the greatest things that can keep people rooted in the environment is having a home and having a mortgage tied to that home and having their children grow up there. And that's one of the things that the government is actively addressing, creating homeowners among the Guyanese population. So people can apply for their house lots, apply for their turnkey homes, and actually own a piece of what's available. And that is one of the key things we hope, not just by raising salaries, but by giving people property and making them into property owners in landlords, that they will actually stay more in the country rather than going elsewhere. And those of us who have been elsewhere, and it's not always a bed of roses, so you might say. It always challenges. Just relocating itself is a difficult challenge.
Just a follow-up question. With all this state-of-the-art equipment that's being installed in the 6 regional hospitals, as well as the other 6 that are being built throughout the country, I was wondering what happens when these equipment break down? Do we have the technicians available to service these machines, or we got to fly in somebody from overseas to look after them, or is there a training program to train our local technicians so they can service this machine whenever there's a breakdown?
Yeah, so we have learned a lot from previous experiences, and that's one of the enduring legacies, that we have had to face deficits in after-sale service for a number of major pieces of equipment. Thankfully, having learned the lesson from the past, all of the supplies and of major equipment to these hospitals, they come with an after-sale service that is extended, not the usual 1-year factory guarantee or factory warranty, but the commitment of the company that's selling them to actually have a presence in Guyana, to be able to service, manage, and do preventive maintenance as well as corrective maintenance of all of these equipment. And built into their contract is not just to sell us and walk away, but also to train technician and to build local capacity for maintenance of these equipment.
Excellent. Thank you. Professor Buru, over to you.
Yeah, Dr. Carpen, I have 2 and maybe 3 questions that are more futuristic.
I gotta take my pen and write them down.
Yeah, leapfrogging, perhaps. There seems to be a consensus that AI will lead to job losses in many sectors of the economy. We have experienced the effects of long-term isolation due to COVID-19. Last year, I looked at some records from WHO. And what our records show is that there has been increase in anxiety, depression, post-traumatic stress disorder. Is Guyana proactive for the needs from the implementation of AI? This also occurs incidentally from countries that have actually start becoming rich. See a lot of depression, a lot of suicidal thoughts, and so prevalent in these societies.
Prof, thank you very much. Indeed, with the introduction and more utilization of AI, certain jobs will become redundant. But one of the strategies that we have pursued in Guyana is a continuous retraining and making available opportunities for training and upskilling of our population. We have a very robust program that is available free to all Guyanese, upscaling for improving their skills, their knowledge, for gaining certification. And this is the Gold Scholarship, which is a program that was put in place a couple of years ago with the new government. So especially persons in the service industry, persons in any category, actually, if you want to pursue higher training to either change career, to improve vertically where you are, or move laterally, the opportunities are there. So while AI may displace some persons, there's also lots of opportunities to even get into the AI space. And we are moving into directions where we're hoping to have the largest data bank set up in Guyana in the near future, before the end of this presidential term. And that itself brings with it thousands of new jobs in the technology sector. So we're very, in as much as we may lose some traditional jobs, we are going to have avenues for persons to train and upskill and move laterally as well. The next question you raised was a very serious one of the post-COVID syndrome of anxiety, depression, mental health. And that is real. And being a part of the COVID response in Guyana, we saw that not just in adults, but more worrying in children who had to be at home doing online school, etc., during that prolonged period. And we have had significant issues with that. And in recognition of that issue and others, the Honorable Minister of Health, Dr. Anthony, and his team have put out a national mental health strategy that seeks to incorporate mental health services across the country in all of the new facilities, the old ones that have existed, and to decentralize mental health care, because we all are Guyanese. You remember people referring derogatively to the Berbice Madhouse, etc. So if people stay away from that institution because of the stigma attached to it. And that was harmful to a lot of people who actually could have benefited from the expert care that was available there. So the National Mental Health Strategy seeks to break some of those stereotypes. A patient can just go to a hospital. You don't know what they're going for. They could be going because they stumped their toe and they can't walk properly, or they have mental health issues that need professional. So we have, within the system, started a program to capture those patients and to be able to help them in the best way possible for the best outcomes.
Now, you mentioned 4 strategic areas. I didn't specifically hear you say anything about societal healthcare education, and perhaps that's included, built in there. So my position is this, that for a healthy society, you have to have some lifestyle change, especially now that you're getting richer, so that you make very low use of medical facilities such as hospitals. What is your response?
Yeah, I have evolved my opinion on that over the years. And if human behavior was the only solution to our disease epidemic, then we would have cured HIV a long time ago. We would have cured syphilis before penicillin was invented. People behavior is the hardest thing to change. And as the country gets more and more resources, we have to use technology, we have to use development to fill the gaps where human behaviors fall short. And so, we will continue to advocate primary care and primary prevention, good diet, exercise regularly, don't smoke, early screenings for chronic diseases. But we also have to be realistic and look at the examples of the most successful countries for public health care. You look at the Scandinavian countries. In as much as they have excellent primary preventive care, they also have excellent tertiary and advanced care. So it has to go hand in hand. So my views on this, we have to spend money on prevention, but we also have to develop the interventional aspect when prevention doesn't work. Because our population in particular, those of South Asian descent, have a higher risk for all of the bad things that kill people early, all the coronary disease, all the kidney disease, the stroke, heart attacks, all those things. And sometimes, even practicing the best ways, people eat no meat, practice a full vegetarian lifestyle, still end up with premature coronary disease. There are certain genetic components we cannot get away from. So we have to be able to use technology, to use what's available to manage, intervene, and produce the best outcomes in those patients.
Yeah. Well, we probably need to use bone moringa or Saijan, but but my last question before you pass on to Dr. Ramki soon. Are there plans to make Guyana a medical tourism hub?
Yeah. So back to your the site and Moringa thing, that goes best with us, all right?
Mhm.
Yeah. So medical tourism, wherever it exists, it's icing on the cake after you have been able to satisfactorily serve your native population. If you can't serve those who are native, there's no point. It's a hard sell to get those who are not native to come. So I am certain that that's the direction in which we are headed. And there are some advanced facilities on the pipeline, mainly private sector driven, with government incentives that are going to specifically cater for our tourist population. One of the things, that has been great about this administration is that we've put in place significant incentive for private healthcare investment. And the biggest of the lot is no corporate tax on profits. You have also no tax on importation of medical equipment and building material. So the incentives to actually create facilities and provide services are there. Private sector now has to step up and take it. So, those are some of the things that we have put in place. And, the president is a very firm believer that this is the way that we should be going.
Dr. Atkinson?
Dr. Kishore, over to you.
Oh, thank you. Thank you very much. Doc, a lot of progress is being made here. My question to you is, do you see a role for the diaspora in the healthcare sector?
Absolutely. Some of the most brilliant minds in medicine have had their humble origins in Guyana. And, we recognize that currently we may not provide all the opportunities and all of the fertile grounds for that kind of growth to explode, but we are getting there. And we are indeed collaborating and building collaborations with our Guyanese diaspora in healthcare. I can talk to you about what happens in cardiac care, the development of cardiac surgery and the whole cardiac program in Guyana was through the intervention and collaboration with a group of overseas-based Guyanese to first start the Caribbean Heart Institute. There's lots of opportunities. You don't necessarily have to move back and move your whole family to Guyana, but there are people who are living here with, some level of expertise in the field that the diaspora has always had experience in, that you can partner with those people to create things, and you're able to make significant contributions. Now, that's from a service perspective. There's also lots of opportunities coming on the horizon for the diaspora, medical and otherwise, to have investment in the country. Lots of investment opportunities and instruments are being developed, targeting specifically the diaspora to get involved. We want to have the diaspora to also be at the table. Part of this heritage is the diaspora's heritage. And it is only right that when the opportunities come, the diaspora has an equal opportunity to benefit from it. When the pie is being shared, the diaspora should have a seat at the table. Both the challenges and the successes.
I agree with you 100%. The reason I asked, there are quite a few nursing staff in they're retired psych nurses, nurse practitioners, PAs, quite a few of them I know. And they would love to go back and do some work in Guyana. But one of the challenges for them, they don't know who to connect with and how to provide their services. And they don't want to do, like you said, they don't want to move back, but they would like to come and spend 6 weeks, and they will pass the baton on to another nurse for another 6 weeks. And among themselves, they can help to develop things in the psych area. I don't know. This is something. Is there a website that they can register themselves to, like people in the healthcare field who would like to go back and volunteer in the Guyana system? Do we have a place that they can register, like a website or a contact number, the consulate? Who can they contact?
I can't answer that with certainty at this moment, but that is actually something very useful for me to pursue, and I will certainly raise that. I know at Ministry of Foreign Affairs there is a diaspora desk, and perhaps it's time that we should have something similar, if it already doesn't exist, at the Ministry of Health, for us to have avenues for our overseas-based Guyanese to assist at home as well.
I think overseas base healthcare providers are going to really help. I know Guyanese are very smart, and this new digital system is going to be rolled out, and it's very seamless. But people who worked with EMR in the past, who understand, how to navigate the system and the do's and the don'ts, the advantages and disadvantages, should be a part of the team when the government is trying to recruit an EMR system for the country. I think it will help the Guyanese government and all Guyanese as a whole if we can sit together and get the best system that works for us. Not knocking anyone down, but I think people with experience with the system will have a better insight into getting the system with the Guyanese population who knows exactly what's needed.
Yeah, I agree with you.
Yeah, I think Dr. Kishore, the Ministry of Health will normally have to give permission to any group who go in there to do medical work, medical outreach. I don't know if they have changed that, but I know groups have been going down there and they have to get approval, submit their credentials, got to approved by the medical board in Guyana, etc. So that's
There's some statutory legal registration process that happens, or is required for everyone that comes in to do any kind of medical practice.
Yeah.
Whether it's voluntary, short-term, long-term, for profit, not for profit, etc.
I think if we set up that help desk that you were talking about, that will really help.
It's something to be pursued for sure.
Yeah.
Okay. Yeah, Dr. Robinson, I just wanted to say, because I'm working with two other guys on creating a website where diaspora can register for all kinds of professional services.
That's very good.
Yeah, that's
okay.
fantastic.
All right, we are nearing closing time. So, Shamisa, you have any questions for Dr. Carpen?
Dr. Carpen, we have seen over the years that mental health, which we've spoken a little bit about tonight, alcoholism and suicide has been affecting our people like crazy in Guyana. As advisor to the president, what are your plans for these specific issues? And how can people in Guyana, how can we get our people to change their mindset? Because I feel a huge part of this has to do with the mindset of the people. So as the advisor, how are you tackling these issues and what are your plans in place?
So the issue of alcohol abuse, because alcohol consumption versus alcohol abuse is different issues, but alcohol abuse has been a real problem plaguing our country and most of the West Indian society for a number of years, and all of the downside that comes with alcohol abuse is prevalent in almost every part of the Caribbean that you will go to. Specifically for us, it has led to significant adverse outcomes: domestic violence, suicide, abuse, etc. There are a number of issues that need to be addressed, and putting laws in place is one thing. For example, selling alcohol to minors, and those are, and criminalizing and enforcing certain breaches is a different challenge. Making the laws and saying that this is right, this is wrong, this is illegal is one thing, but to be able to enforce it is also another challenge. But it's certainly something that has to be looked at from a holistic point of view, a mental health point of view. And part of the challenge and part of the solution would be education of the population. If people are, educated properly and they have examples of good versus bad behavior, then, responsible alcohol consumption, alcohol use is not something that we should outlaw or make illegal, but it's something that, you know, one has to recognize that line between the responsible consumption and the irresponsible or abusive consumption. So alcohol tends to be a very, hot button issue that people may or may not want to tackle, but it's certainly something that needs to be addressed. The mental health overall aspect of it when it comes to suicide, etc. Again, is one biggest strategies to combat this. We have done several things over the years to make certain toxic substances outlawed, not being able to be used in crop management or agricultural processes. So we make it less available to the potential victims of suicide. So those are small steps, but in the right direction. I believe education, mental health strategies, mental health counseling should be available. A lot of people have depression, anxiety, significant mental health issues that go unrecognized. For one reason or the other, even when it's recognized, people do not seek appropriate treatment. And it can't just be the individual that is held to that standard that they must go and seek help. It's a community issue, it's a village issue, it's a family issue. And we're all responsible for those around us, not just ourselves. So a lot of this has to do with awareness, education, and teaching people that they do have a responsibility, not just to themselves, but to those around them.
How many psychiatrists are there in Guyana?
I can't tell you exactly how many, but for a number of years there was just one or two. But we certainly have, gone significantly above that number.
The last figure I was told is, I believe, either 6 or 8. But I think we really need more.
We definitely do need more. We touched a little bit on diabetes tonight, but two of the things that we have major on hypertension, thyroid. I know we haven't spoken about that, but one of the main issues in Guyana over the years that I know of, I have a family history. My dad's side of the family is thyroid, my mom's side is diabetes. So somehow my genetics, I've already been on medication for thyroid. How can we help to prevent these diseases, and what is your administration doing to make sure that people are either educated on this or they're given prevention in case of these two major illness in Guyana?
But thyroid disease, diabetes, etc., traditionally in our country, culturally, people only wait until they're sick and then they go to see a doctor. What we would like to see and what we're pursuing is to create a screening culture in the country and to be able to tie that in to several of the measured outcomes. So, for example, we're looking at, let's say, at age 35. We want every citizen, I'm just putting out an age number there. You want every citizen to have their height, weight, blood pressure, blood sugar, cholesterol, thyroid function tested, and for the appropriate interventions at that time to be made. So if that person, for example, has a high BMI, we want to encourage what Professor alluded to have a proper dietary regimen, exercise, etc., to check the blood sugar. If it's borderline, you have appropriate interventions. But if they're already diabetic, you also have interventions that you have to do. So there's nothing that could actually happen without proper screening and early detection. But once we start to build that program out and to create that culture where people go to seek health care before they actually become sick, we'll have a significantly different outcome than to just wait until you get sick and then turn up to hospital in an emergency.
I think that Professor Budu, you can make your last comment, likewise Dr. Ramkisoon, because we are coming to the close of our program. Professor Budu, over to you.
Every time we have guests in the medical area, and Dr. Carpen, you're one of them, it's very impressive, or nothing short of impressive, the healthcare transformation that is taking place in Guyana. But there is another thing that impressed me, and it's not only impressed me, but I'm proud of, to see the people who are involved in this, like yourself, right? The knowledge that you bring to bear in this area, right, is stunning, right? And I think you guys that we at least had on this show are the best internationally. So it's not only in Guyana, but I think internationally you are the best. Because I've had the opportunity to meet a lot of people in the medical area also, right? And I think that you guys are really doing a fantastic job.
Thank you. Dr. Carpen, Dr. Kishore.
Yes, Doc. Dr. Carpen, thank you very much for being with us and sharing the highlights of what's happening in Guyana right now and the transformation. That's the rapidity of the transformation in Guyana healthcare and all of Guyana is tremendous. And once again, I would like to congratulate you on your new role. And I'm very proud and I'm very happy that the president had chosen you to guide him. I think with good guidance from a person like you, there's going to be tremendous benefit for everyone in Guyana. So I thank you very much. And I'm looking forward working with you in any way we can to benefit the people of Guyana day in and day out. I know you're at the bedside and then you're at 1 minute you're at the bedside and 1 minute you're at the president's ears. So you're the right guy to transform the care.
I
appreciate it.
I endorse what Dr. Ramkisoon said and Professor Budu about Dr. Carpen. He's indeed an exceptional Guyanese, and we are all proud of him. So, Shamiza, would you ask him to do the closing statement?
Thank you, Dr. Tara. Dr. Carpen, we will now ask you for your closing remarks.
Well, thank you all so very much for having me on the program. And thank you for being kind with your questions. I really do appreciate it. But I also appreciate the opportunity to share with you and to share with the diaspora what is happening in Guyana in the area of healthcare. We are very fortunate at this time to be in this position, and I believe we're on the right track. And once we stay the course and continue to focus on our patients, our fellow Guyanese in this population, I believe we will get to that magical place that we all aim to, where people receive quality health care in the best time and they are happy and satisfied, not just themselves but their family. I thank you again for having me, and anytime I can call on you, I certainly will. And feel free to visit Guyana as often as you can. Feel free to contribute. You're all welcome. You're all Guyanese. And thanks again.
Yeah, we're glad to have you. We'll try to get her back on another occasion in a few months' time. So thank you very much. Shamiza, over
Dr.
to you.
Tara, well, thank you. Thank you to our entire panel for taking the time to be here this evening. Thank you to all of our viewers. Before we go this evening, I would like to take this opportunity to wish my Hindu brothers and sisters a very blessed Diwali. On behalf of myself and the team, the Guyana Dialogue, thank you so much for taking the time to be with us this evening. Until next time, I'm your host, Shamiza Ali, and this is the Guyana Dialogue. Good evening, everyone.
Thank you.
Good evening to you.